Hello, this is Brian Degenhardt, and I'm the director of the A.T. Still Research Institute and of the practice-based research network called DO-Touch.NET. In response to our recent posts on how osteopathic manipulative treatment and therapy can be used during the COVID-19 pandemic, we were asked if there were activities a person can do themselves based on osteopathic principles that can help their body resist infection. We offer this short self-help video as one way to address this important request. Everything is healthier when there is freedom of motion. That is especially true for fluids in the body. Let's first take an example from nature. When fallen trees block water from entering or leaving a pond, its water stagnates, causing the wildlife that live in and around that pond to progressively weaken and over time die. This is also true in our bodies. Cells need the fluid around them, called interstitial fluid, to move too. This fluid brings food and oxygen to cells that they need for energy and for ideal function. The interstitial fluid helps the cells to communicate and for our immune cells to move throughout the body so that they can fight against infection. Fluid motion also removes waste that the cells normally make. During an infection, removing waste is extremely important because swelling, also known as inflammation, is caused by large amounts of waste made when bacteria, viruses, and cells are killed as the body fights the infection. If this waste is not removed, fluid stagnates, cells weaken, and in severe cases, they die. Just like fallen trees, tissues that are too tight slow down or stop fluid flow, which weakens cells' ability to fight infection. Our first activity is to help you identify and to release tight tissues. The other activities gives you ways to help move fluid between the cells of the body to help keep them strong and healthy. Areas of our body that are tight will slow down the body's movement of fluid, like the trees damming the water of a stagnant pond. There are many good sites online that will demonstrate how to stretch. An important guideline is to remember to stretch slowly to the point where you feel tightness but not pain, and to hold that stretch while you take 2 to 3 breaths. It is likely that every day your body will have different levels and areas of tightness. Consequently, how you stretch each day should be modified to where you feel tightness. Our second activity is breathing. Breathing fresh, clean, circulating air helps to bring oxygen into our lungs. From there, our body's fluids bring oxygen to every cell. Ideally, when we breathe, both our belly or abdomen and our chest move as our diaphragm moves. That is, the muscle we use to breathe. So let's become aware of our breathing. Place one hand on your chest and the other one over your belly button. Breathe in through your nose and out through your mouth. How do your hands move? Breathe more deeply. What do you feel? Ideally, as we breathe in, our abdomen initially expands. When we breathe more deeply, our chest also begins to rise. If you feel the belly and then the chest rise as you take a breath in, you have a good breathing pattern. If you feel only your chest or abdomen move, get in the seated position with your feet solidly planted on the floor. If your abdomen does not move, arch your back and take slow, deep breaths in. Breathe several times until you can feel your abdomen moving easily or if you feel tired or short of breath. If you feel most of the motion occurs in your abdomen, slump forward and then take slow, deep breaths. By doing so, you will be helping your ribs to move better as you breathe. This activity should be repeated for several breaths and can be performed often during the day to help your rib cage move better. Another way to stretch your back and get better rib cage motion is by doing what is called spinal breathing. You begin this by breathing all of your air out as you curl your body around the lower part of the abdomen. As you take a deep breath in through your nose, bring your arms up and out as you slowly arch your back and look towards the sky. After a short pause, breathe out through your mouth. Do this several times until you feel your back and your ribs move easily. As you breathe out through your mouth, try to breathe out or let go of some of the stress you feel. Stress is very powerful in causing the body to tighten and to hamper your body's ability to fight infections and heal itself. The next two activities are best done standing. First, become aware of how you are standing. Your knees, hips, and shoulders should be in a vertical line, one above the other. Make sure your belly is tight and the lower spine is not arched. Your knees should not be locked and your arms should be relaxed, hanging down by your sides. Begin the activity by slowly twisting your hips, first in one direction and then in the other. Let your arms swing without effort around your body. Keep your eyes level, and your hips, shoulders, and eyes should stay within the same plane as you rotate back and forth. As your body loosens up, you should be able to gently twist or coil more. This is like wringing a washcloth to get fluid out of it. When the body is positioned straight forward, fluid fills between the cells. When the body twists to the right or to the left, fluid gets pushed in different directions. After twisting for a couple of minutes, you can increase the activity by slightly bending and straightening your knees. If the twisting causes discomfort in your knees or ankles, you can slightly change the activity by stepping outward as you twist to the right or left, and then move the foot back inward as your body untwists. Do this for several minutes. Stop if you get short of breath or if a part of your body begins to ache. The last activity is making the body like a spring. Bounce your body up and down by slightly bending and straightening your knees. As you do this, become aware of which parts of your body feel like they are bouncing. Your belly, chest, arms, hands, and head. Make sure you are standing up straight as you've been previously instructed. This bouncing will help fluid move throughout your body and can be done for several minutes. The goal is to be able to feel throughout the body the springing that you are creating at your knees. Stop if at any time pain develops, which can commonly happen in the knees, calves, ankles, or feet. If you have forms of arthritis there, or if you're not used to doing this type of activity. These simple activities of stretching, breathing, twisting, and springing can be done daily or twice a day to help to keep your body's fluid flowing. In most cases, these activities are painless unless you have some underlying medical condition. Whether you do or not, make sure to listen to your body as you are doing the activities and stop if you're getting unusual pain, increasing pain, lightheaded, or dizzy. We wish you health and happiness as you actively promote your well-being.